All right, today we're going to be talking about the vertebral column, the different types of vertebrae. Starting from left to right, we have the cervical vertebrae. There are 7 of those. Thoracic vertebrae, there are 12. And the lumbar vertebrae, there are 5. Starting with the different landmarks on the vertebrae, I'll use the lumbar here. We have the spinous process here, the transverse process on each side. In between the transverse and the spinous process is the lamina. And there's a surgery called a laminectomy. I'll get to that in just a moment. Then we have the body. In between the transverse and the body is the pedicle. This is the superior facet and the inferior facet. Then, if we look down through the top, that is the vertebral canal, or the vertebral foramen. That is where the spinal column runs through. And back to the laminectomy. So in some cases there can be pressure on the vertebral column, on the spinal cord, and the laminectomy actually shave away or remove all of the lamina to relieve pressure on that. Okay? Notable feature about the cervical vertebrae as well, they also have these transverse foramen. That's where blood vessels pass through to get up to the head. In addition, there are 2 special cervical vertebrae, the atlas and the axis. This is C1, this is C2. Notice how on the axis, there's this structure here that is called the dens. And in the body, they're going to sit on top of each other like this to form the atlantoaxial joint. And then the skull is going to sit right on top of the atlas there to form the atlanto-occipital joint. That's going to allow for the skull to look up, look down. That's going to flex and extend the cervical vertebrae. And this structure, the dens on the axis, is going to allow us to look left to right. It's going to allow our skull to turn and rotate. Another important feature of the vertebral column are vertebral discs. These sit in between the different bodies of all the vertebrae. They act as shock absorbers. They also hold everything together and just allow, they turn this into a joint actually, so they allow for movement. Something to note about each one of the different vertebrae, they all have different types of facets. So we talked about superior and inferior facets. On the cervical vertebrae, they're going to be oriented kind of in multiple planes. That's going to allow us to flex, extend, rotate, and it gives the cervical portion of the spine a lot of mobility. On thoracic vertebrae, you'll notice how they're oriented in the frontal plane. That's going to allow for a lot of side bending. In addition, when we put 2 of these together, Brad, could you actually hold this for me? Thank you. When we place 2 of these together, you'll notice this kind of hole right here that forms. That's called the intervertebral foramen. And from the vertebral foramen that we mentioned earlier that the spinal cord passes through, this intervertebral foramen is where branches off the spinal cord, blood vessels, and nerves will exit the spinal column. Thank you.